We're talking today with Dementia and Alzheimer's Wellbeing Network founder Judy Cornish. You're connected with the Heart of Hospice. I'm Helen Bauer, here with Jerry Fenter.
Whether you're a family caregiver or an end-of-life professional, we're here to enhance your hospice experience by connecting you with information you can use about end-of-life care. Today's episode is sponsored by our friends at GrandPad. Do you have an older family member who's isolated, or do you feel disconnected from a senior loved one who lives at a distance? The team at GrandPad has come up with the perfect solution, an easy-to-use device that connects older adults with family and friends using video chat, email, photo sharing, and more. Visit grandpad.net for details.
Our guest today is one of the smartest people. She was so impressive. I learned so much from her. She's just an amazing lady.
She really is.
And the work she's doing is impressive.
And how she came into this work with Alzheimer's and dementia was inspirational.
Yes. So she's not saying that her mother had Alzheimer's or dementia. She is not clinical. She's not worked in the healthcare industry. She is a retired elder law attorney.
Right, an attorney.
Yes.
And she found herself living in the small town of Moscow, Idaho, because she wanted to live. She was done working in the large town and she wanted to move to a small city. So she moved to this little town in Idaho. And there, a neighbor across I don't want to tell the whole story.
Yeah. Judy Cornish founded the Alzheimer's and Dementia Wellbeing Network in 2010. And through her hands-on work with dementia, she developed this proprietary method for working with people who have dementia, one that helps them develop and retain a sense of security and well-being. She calls it the Dawn method. It's simple enough to be used by caregivers in the home, but you can also use it in care facilities as well.
Yeah.
It's an amazing technique. She's got online courses, and we're going to let Judy tell you the story, quite a remarkable story, of how she went from being an elder law attorney to being a hands-on dementia care provider and then developing the Dawn method.
So here's our interview with Judy Cornish. Judy, it is a joy to have you with us today. Thanks for joining us on the Heart of Hospice podcast.
No, thank you for inviting me.
So we want to start because we were talking to you before the interview started about your TEDx experience. You have a TEDx talk that you did, and I want to go back to the story that you told about going to a restaurant after the talk. Tell us that story again.
Oh, well, so my TEDx, my slot was 11:30 in the morning. And so it was about noon when my friend Debbie and I left the theater to go get a bite to eat. And we were sitting in the back of a restaurant in downtown Spokane, and it gradually filled up. That when we stood up to leave, the people sitting in the table next to us, one of them said, "Are you Judy Cornish?" And I said, yes. And the entire restaurant stood up and clapped as we left.
Wow.
But when you're talking about dementia, and I think what that tells you was that dementia has touched all of us. We either are experiencing it ourselves or it's somebody in the family. It's a friend. It's something that we need to be working with. Or if we don't know how to work with it, it's devastating. And I think that's true right now in our country. It's devastating families, financially, emotionally, as not just government. You know, we know the huge cost to Medicare and Medicaid. People who are experiencing dementia and the families don't know how to work with them. And then it just gets more and more expensive as you go forward.
Well, your experience there in the restaurant, I think, showed how much it touches people, how much it touches people's lives. And we also know that it's going to be increasing. The number of people who are going to be experiencing dementia or Alzheimer's is going to increase. So you have been an elder law attorney for many years. What made you decide to make that jump from working as an attorney to founding the Dementia and Alzheimer's Wellbeing Network there in Idaho?
It wasn't a purposeful move. I had been practicing law in Oregon, in the city of Portland, and decided that I was really looking for a quieter life. And I wanted to be in a small town, somewhere more rural and somewhere near mountains. And so eventually I ended up in Moscow, Idaho. But when I arrived there, my goal was just to practice elder law just a few hours a month. And what happened was I got to know a neighbor, the lady across the street, this wonderful person. I'd gone over, she was out watering her tomato plants. I went over and introduced myself. And pretty quickly she told me, she said, well, I'll never remember your name. I've been diagnosed with Alzheimer's. And the thing I'm best at right now is being forgetful. But she was just a courageous, beautiful, intelligent person. And she was working around her fading memory skills. She had an intricate system of sticky notes and notes to herself, a day timer, a calendar. She would assign herself half an hour to water the tomatoes. And then a buzzer would go off, the kitchen timer would go off, and she'd go back and read what she should do next. And I had not really been exposed to people experiencing dementia or Alzheimer's in the past. I was an attorney. And my undergraduate work was in literature and languages. But what, we've all heard about dementia, people just kind of go crazy and you don't know what to do with them and you have to lock them up and drug them. That's kind of the impression I had. And that's not what I was seeing happening to her. And all this, one weekend her daughter came to stay, and I remember her daughter came over and to introduce herself to me, and she said, well, Mom's getting too forgetful. She keeps losing the car. So I'm going to put her in the care facility over there. And it sounded like she was going to put a piece of baggage in storage. We're going to put her in a care facility. And I just, I had to say, oh, don't do that. I'll help. I buy groceries. She can come with me. She wants to go swimming in the mornings. I'm an early riser. I'll take her swimming. I can do my email or read a book while she swims. And it's a small town. And within a couple of weeks, I think I had half a dozen seniors living alone, living at home with dementia. And the kids would call me and say, hey, I hear you're looking after so-and-so's mom. Check in on my dad. And that's how the Dementia and Alzheimer's Wellbeing Network started. And right from the start, I knew what I was looking at, what I was seeing these friends of mine, these neighbors, what I was seeing happen to them was not that they were going crazy. I was seeing intelligent, courageous people figuring out how to live without certain skills that were fading. And that was it. I was hooked. As soon as I'd spent a few weeks, I never did get to practice law in Idaho. There really is, there's a way to work with dementia. It's not random. It doesn't, and the main problem is that we're looking at it using the wrong model. We look at dementia and we use a medical model and we say, this is disease and there are symptoms. You go to a neurologist, they say, you're going to see loss of memory skills. And then we forget that part and we think, oh, okay, we're just going to remind mom or dad. And we're just going to jog their memory. Then they're going to remember. But no, they're going to lose memory skills. So they're going to lose the ability to recall or bring back information from the past. And then the neurologist says, and there's going to be changes in executive functions. And we think, okay, we don't know what that means. So we'll just keep explaining to people that if you lose executive functions, we're talking about losing the ability to use rational thinking skills, analysis, comparative thinking, your ability to understand why or to understand an explanation. And so when we continually push people to use skills that are gone, we cause stress reactions. You get fight or flight. you get freeze, you get fawn, you get these stress reactions. And if you really look at what we call the symptoms of dementia-related behaviors, what you're seeing is stress reactions. So I think the model's wrong. And to me, that's what the Dawn method is about. And that's what I've spent the last more than a decade now, I guess. That's what I am trying to do, is to bring light to this pattern. The pattern is experiential. It's not medical. It's that people are losing cognitive skills, very specific ones, memory skills, rational thinking skills, and attention skills. And when we lose very specific cognitive skills, it's embarrassing, it's frustrating, and it's scary. And so we react with fight or flight. And when you go through that list of dementia-related behaviors, that's what they're all about. Fight or flight, restlessness, exit-seeking, sundowning, combative behaviors. All of those are symptoms of a human being who is uncomfortable emotionally. And so instead of using a medical model, we should be looking at dementia from the perspective of experience. What's this person experiencing? How is it changing their functions, their ability to function? And if you do that, then it's not random. It doesn't look like somebody's going crazy. It's predictable. You can work with it, and you can see what their strengths are. And we have very specific strengths. And I always tell people the best things in life, our ability to enjoy beauty, our ability to enjoy companionship, our ability to feel positive, enjoy feelings and emotions like joy, love, anticipation, all the good things in life remain 100% accessible to us when we're experiencing dementia. The problem is that our companions don't understand that, and they don't know how to help us continue to enjoy those things. And they keep embarrassing us and frustrating us by demanding that we do these things we no longer can do. And that comes from not understanding what it really means to lose skills to dementia, the experience of dementia.
So you have created what you call the Dawn method. And I'll be honest, I have not read about it. I think maybe Helen has. But I would like for you to tell our listeners in more detail, what is this Dawn method and how does it work? And is this something that people can use in relating to those with Alzheimer's and dementia?
Absolutely, yes. It took me 5 years, from 2010 till about 2015. I spent more time with people who were experiencing dementia than people who weren't. And then I started trying to figure out, okay, now that I understand, now that my clients, my friends, my neighbors have taught me what it means to experience dementia, okay, how do I now communicate that to families or to dementia care professionals? There's being an attorney, I had to think about this in terms of applying systems, applying facts to a framework. And so metaphor. What would be the metaphors? And the first metaphor to look at dementia, I thought, well, I could just teach people to understand what it means to, what our rational thinking skills are and what our intuitive thinking skills are. What it means to lose your remembering self, a psychological concept, and what it means to keep your experiential self, what it means to lose your ability to manage or direct your attention, and what it means to retain your ability to focus and experience intensity. And so I looked, that was how I first approached the problem of communicating and training and teaching what I'd learned. That seemed a little bit too dry, too intellectual. So then I thought, okay, so let's go back to the drawing board and pick a different metaphor. And I thought of Abraham Maslow and his hierarchy of human needs. And I know recently, in the past decade or so, there has been a lot of criticism of his model, the pyramid. Well, that was 1942, and we weren't thinking about feedback loops in 1942, and pyramids were pretty, that's two-dimensional. But the theory, the information is valid. that we as human beings, because of the design of our bicameral brain, we really cannot feel safe and feel good about ourselves unless we know the people we're with or the environment we're in is secure. And once we do feel safe, then we can begin to experience happiness and joy and fulfillment and purpose and all of the good things of self-actualization. So I went back to the drawing board and I thought, all right, we need a feedback loop, one that everybody can understand. And so I selected the flower. And looking at dementia from the perspective of our human needs, emotions, and well-being, then you can use a flower and you look at security needs first, the center of the flower, mood management, wrapped by two sepals. And that would be we need to learn that we are safe with certain people, that they won't be getting angry with us. We need to learn that even though we're becoming ever more confused, we can still be safe. We also need to learn that even though we're becoming less able to do things on our own, we can still be safe. And once you've learned that, once those security needs are met by your companions, then they can give you well-being. Then you can experience fulfillment and joy and companionship and all of the good things of life. And so that's what finally became the metaphor for the Dawn method. So in sum, the Dawn method, what I do is I teach families how to recognize which skills are fading or gone and which skills we keep. And if you understand which skills your loved one is still using, you'll be able to recognize the emotional need that drives the behavior. And if you can solve my emotional need, you don't need to worry about negative behaviors anymore. You'll be coming back from conflict and disruption back to companionship. So that's what the Dawn method is. It was looking for a metaphor that we can all grasp and understand how to support and work with somebody when they're losing skills, those very specific skills, limited skills to dementia.
So I noticed on your website that you actually use a flower as a way to describe the different areas of the dementia care, which is very interesting. And I that's really, really good the way that it works. You know, you're talking about the social success, the sense of control, the secure future, sense of value as some of the outer areas of a person, and then moving inward toward mood management. So give us some details. How would a person who has a loved one with dementia use this method in a day-to-day situation?
I think it comes first from, you can't escape it. You do have to understand what your loved one can't do anymore.
Okay.
So, and with the flower, I picture a flower as a feedback loop in that center, mood management. When I'm losing my rational thinking skills, I lose my ability to use spoken language. I lose my vocabulary, and eventually I lose my ability to understand the spoken word. People will lose secondary languages, retain their childhood language the longest, but eventually that goes. What doesn't go ever, because it's a part of our intuitive thinking skills, is our ability to read nonverbal communication. And boy, once a family member comprehends, understands that pretty soon the time is coming when their loved one it's going to be like the Charlie Brown cartoons. All the adults were just a murmur of noise in the background.
Right.
Okay, picture it being like that. But your loved one is becoming an expert at reading your emotions from your facial expression, your body, your posture, your gesture, and your intonation. Never will they lose that, and they're getting better and better at it. So what that means is, and mood management, okay, so that's what they're doing. Now, what they can't do, which is due to the skills lost, they're losing rational thinking skills, and they're losing memory skills, which means they are going to lose the ability to manage or change their own moods. So think about that together. Here's this person who's becoming an expert at reading your emotions. And at the same time, they can't change their own. So daughter walks into the room. Mom is sitting there, maybe flipping through a magazine or watching something on television, listening to music maybe. And daughter comes into the room, and on her face is a frown. She's frowning. Now, why is she frowning? She's frowning because she's exhausted. She's a caregiver. She's solving all the problems in her life and Mom's. Mom's becoming less able to perceive risk because she's losing rational thinking, which includes cause and effect and sequencing and prioritization. And so daughter shows up in the doorway and she looks at Mom, and she might be concerned about something, or she's been trying to figure out the bills. There's a frown on her face. Mom looks up, sees a frown, and based on her personality, she's going to respond negatively. She might look at the frown on her daughter's face, and her response might be, so what did I do this time? What have I done now? Okay, so now you have a mood problem, but you also are going to have conflict. And daughter will become ever more exhausted because the conflict will be constant. Or Mom might look up at that frown, and due to her personality or their relationship in the past, she might say, oh no, now what have I done? And she might feel guilty. Okay, if she feels guilty, then once again, we've got a mood management problem, and daughter is going to have to work really hard to bring Mom back to a place where she is comfortable and happy. But she might also be afraid. She might look at that frown and think, oh no, my daughter knows what's going on. I don't. She's frowning. Something terrible is about to happen. And so you can end up getting these negative emotions just because there was a fleeting expression on your face. So, that is the beginning. We start at the center of the flower, and you have to understand nonverbal communication, these intuitive thinking skills that our loved ones continue to use, the rational thinking skills they lose that would have helped them interpret reasons for your frown, or their memory skills, which would have helped them recall why you might be frowning based on past events. And so with families, what I do, and with the Dawn method, we have to start with an understanding of these skills, and then we learn how to work with these changes in our loved ones' skills so that we can support them in a positive manner. Now, I've been more than a decade doing this, and whenever I get to take somebody from the beginning of the dementia journey through the end of life, and especially if I can keep somebody in their own home and put a support team around them, and get the family on board and have everybody in the family working with their changing skills. It's beautiful. It is a beautiful experience. And it's such a positive experience for everybody involved. I think everybody in the family, even caregivers brought in, from outside, the person who's experiencing dementia, it can be a truly beautiful experience to lose the memories of all those things from earlier in life that scar us, to lose knowledge of those things that we've forgiven others for, or maybe not been able to forgive, to lose rational thinking, to lose all of our ability to worry or be concerned. It's beautiful if your companions understand how to help you feel safe when you begin to become unable to grapple with the problems of modern society. So my work with Dawn, my work with people, and I've never been able to get back to practicing law. I've never wanted to, because it's been so rewarding to get to spend time with people who lose the ability to be productive and concerned with all of these things of modern society, and instead they become the beautiful person they were born as. So to me, it's just a real honor.
During the pandemic, older adults who live alone have been more isolated than ever. My mom is the perfect example. She lives in a senior living community that went into lockdown, not only requiring her to stay in her apartment, but also restricting all of her family from visiting. GrandPad gave us the perfect solution to stay connected. Using the video chat option, we were able to see my mom and really know how she was. All of us in her private family network were able to share photos and messages about what we were doing, so she knew we were okay. My mom was really skeptical about using the device at first. She still has a flip phone and doesn't even own a computer. GrandPad comes with a 4G LTE cellular service already included, so there is no need for Wi-Fi. All of us in my mom's private network have shared photos and videos. We even sent her special videos on her 88th birthday, even though we couldn't celebrate in person. Mom has learned to use email, play bridge and solitaire, and listen to music she loves on her GrandPad. We are so grateful to the folks at GrandPad for allowing us to stay connected. You can purchase a GrandPad subscription for your loved one at grandpad.net. Now on to today's episode. So when you work with caregivers through the Dawn Method, and you've actually had a lot of hands-on caregiving experience yourself, what would you say for you personally as a caregiver for someone with Alzheimer's or dementia? What were the major issues that you struggled with? And what are the major issues that you've seen other caregivers struggle with?
Essentially, if you don't understand the changes this person is going through, you are going to be constantly putting them in fight or flight stress reactions. And that is very destructive to our emotional well-being, our emotional health. To be constantly in conflict with somebody you love, I think that's the biggest problem. And the only way to reduce caregiver stress or to reduce the expense of having to put somebody into a care facility with all the staffing and monitoring that involves, is if you begin to be able to recognize what they are doing, what they can't help but do, due to retaining these intuitive thinking skills, due to retaining their ability to read nonverbal communication, to have the beautiful things, that which is beautiful to us, brought into our presence. If you're not doing that, you're causing both the person who's experiencing dementia and anybody who attempts to be a companion a tremendous amount of stress. So I'm not sure if I answered your question. I think I've rambled.
No, I think that hit on it. Basically, it's not making an investment is the way I would look at it in the condition, the status, or the loss of skills for your person so that you can provide an appropriate caregiving environment. It's so it can be enough, I guess, if that's all you want, just to keep them safe, keep them from wandering, help them eat and take care of the activities of daily living. But there can be so much more to it. There's so much more to it.
But think about it from the perspective of functioning and experience. So it's my husband. Let's say my husband is experiencing dementia, and we love each other, and we've been together for decades, and we just want to continue living in our own home.
Sure.
All right. So he's losing rational thinking skills. He's losing the ability to perceive cause and effect. And we live here in Idaho, and it gets pretty cold in the wintertime. We get quite a bit of snow, and it's a long way to town. And so John and I need to go pick up groceries. I say to John, "Hey, honey, let's go get groceries." He says, "Okay." And I say, "All right, so you put your coat on, I'll get my coat, let's go." And he looks at me and he says, "No." I said, "No, you have to put your coat on. Look outside. It's blowing. It's a blizzard out there. You need your coat. So you're going to be cold. It's too cold to go out without a coat. Come on, honey, you got to put your coat on." And he looks at me and he says, "Don't you tell me what to do." That's what usually happens, right? But what have I done? What did I just do to him? I just asked him to use cause and effect. He and I are standing in the house. It's 70 degrees. And I say to him, "Put on your coat." And he thinks, "I'm not cold. I'm not going to put my coat on." So I start explaining. And now when I explain to him, I ask him to use comparative thinking. I point to the window and I say, "Look at the snow out there." And he looks and he says, "Yeah, it's snowy out there." And I say, "See, when you go out, it's going to be cold. You need your coat." All he hears is an accusation of failure. because he has lost the ability to perceive cause and effect, that when he walks outside, he will be cold. And I'm asking him to use comparative thinking, which is one of our rational thinking skills, which he's lost. So what have I done? What I've done, instead of attempting to keep him safe, I have done exactly the equivalent of saying to a blind person, here's a pair of glasses. Put these on. Now I'm going to point. Look where I'm pointing. What? Why aren't you looking where I'm pointing? Come on. You used to be able to see. Why aren't you seeing? Why aren't you looking? And so we inadvertently, through not understanding what it means to lose rational thinking, we are constantly frustrating, embarrassing, and demanding that our loved ones do what they cannot do. And then we're surprised. Then we say, this is exhausting. I explain and I explain. I use simpler words. I explain it really carefully. I speak slowly, and yet he doesn't get it. And that's because we don't understand. He can't use that skill, so don't do it anymore. What I should be doing is saying, hey, honey, you want to go get groceries? Sure. Okay, I'm going to take my coat. Do you want yours? No, I'm fine. Okay, do you mind if I take your coat? I'm always cold. You know me. Oh, honey, you go ahead. Walk out the front door, count to 3, 1,000, 2,000, 3,000. He's going to look at me and go, gosh, it's cold. I'm going to say, oh, good thing I brought your coat. Would you like it? Yeah, thanks, honey. And we're going to have a great time going to the grocery store because I understood that he couldn't use cause and effect. Instead of conflict and disruption of our loving relationship, I supported him. I kept him safe. But how did I do it? Through understanding what it means to lose rational thinking skills. You know, here's the other classic, right? Oh, it doesn't matter. He doesn't remember. He won't remember. It doesn't matter what happens. Okay, how does that work? Are we, in the words of Italo Calvino, the very well-known Italian writer, are we only a combination of experiences and memories and knowledge? Or are we more? Are we actually beings with a presence, with a soul? Someone who's experiencing the present. We are experiencing the present. Now, if I can't remember what just happened, but you just put my sweater on, helped me put my sweater on, and you twisted my shoulder, and that's the shoulder that was injured in a car accident 40 years ago, and you hurt my shoulder, I may not be able to turn to the next person who walks into my presence and say, she hurt my shoulder still hurts. And that's why I don't feel very happy right now. Even though I don't have my remembering self, I have my experiential self. And whatever happens to me, I will experience and I will react to it. It doesn't matter if I can't recall it. I experienced it. I'm reacting to the experience. These things are really important to understand. And when we don't understand what we are inadvertently doing to people who are losing skills and becoming ever more vulnerable at the most vulnerable time of life, then we're not being kind. We are not being helpful. We are not providing care, and we are doing less than we could. And just like anything, it takes knowledge. It's not easy. Human beings are complex. We aren't even just complicated like machinery. We're complex. And so to learn how to support your loved one when they're experiencing dementia, it takes time. I won't let anybody learn the Dawn method in less than 8 weeks. It takes a mind shift. It takes understanding. It takes empathy. And it takes putting yourself in their position and really learning about what these skills are that we take for granted and have no idea we have been using ever since the moment we were born.
So it sounds like a lot of what you're teaching is the caregivers on how to have the right mindset towards the person that they're taking care of, understanding them better in that sense. So you're actually teaching courses to caregivers on how to care for someone with dementia.
That's true. Yes.
Okay. So you mentioned that you have an 8-week course?
Yeah. For families, we have private classes, and I teach, and my Dawn trainers, I have people who I've certified to teach the Dawn method. We teach 8 classes. The family just picks the time, of day or a time when we can meet with as many people as possible. And we meet using Zoom or Teams or whatever works for the family. And we go through an introduction to dementia, and then teaching those 7 tools of the Dawn method. And this incorporates developing an understanding of how to work with the skills kept and recognize the skills lost, and then to recognize the emotional needs so that you can avoid behaviors, not just react to them, but avoid them. I also, for families, have a online series of 36 videos, and we've made that. It's called Dawn Home Care, and that's available online so that people can sign in, the whole family, up to 6 people at a time, and go through a series of videos. And they're all about maybe 10, 20 minutes at the longest. Mm-hmm. But when I teach those 8 classes, there's actually 36 issues that need to be covered. And when you understand those, each video covers an issue, and then that way people can learn the Dawn method on their own time. And then we also have, I have a certification program for professional caregivers that caregivers can purchase on their own and become certified. Or the employer, agencies and facilities can become a Dawn partner and keep their caregivers trained in the Dawn method through an online certification course.
That is excellent.
It really is. So these for professional caregivers, for people who work in like long-term care facilities, or what about even for hospice care?
The Dawn Partner Program, that's designed for like a hospice agency, a senior care agency, a dementia care agency, assisted living facilities, or any of the other types of senior living communities. Individual caregivers, there's a number of us who are self-employed, working for ourselves and taking care of people's loved ones as an independent caregiver. And what I really wanted to do, I wanted to support, more than just supporting people who are experiencing dementia, but also women who are working for such low wages. And what we found is that people who do become certified as Dawn dementia care specialists are able to double what they've been charging on the open market. We're just now beginning to certify people in other countries. So I'm not sure how that's working in other countries, but it certainly works well in the U.S., where you've got somebody who's earning maybe $10, $15 an hour. They're not covered by Social Security. They're not covered by workers' comp. They're not getting unemployment insurance. They're just working directly for a family, getting minimum wage. And once you're certified, then you can say, I am a Dawn dementia care specialist. I understand dementia care. And some of my DDCSs are earning $30, $35 an hour on the open market.
Oh, that's awesome.
Yeah. So imagine how reassuring that is for a family, knowing that you don't just have a sitter, you don't just have an aide, you don't just have a companion. You've got somebody who is experienced and trained and understands how to, for lack of a better description, speak that language that a dementia or Alzheimer's patient, a person with dementia or Alzheimer's would have. I am the family member of someone with Alzheimer's. My father-in-law passed away last summer, in summer of 2021, with end-stage Alzheimer's. And even now, after having been a nurse for over 30 years, I'm kind of ashamed to say this, and been in hospice 12 years, the things that you're saying were things that we never thought to apply to his behavior to understand it.
Right. But do you see, the reason why is that if you're looking at dementia from the biomedical model, of disease symptoms. Somehow, I don't understand what happened, because we do know that the symptoms of dementia are loss of cognitive skills.
Right.
And yet somehow we can't cure that. So we flipped to calling behavior symptoms, which then leads us to use or expect to curb behaviors chemically or with locked doors. And
Yes.
So the problem is that our model of defining the problem, every model that you use to define a problem produces a set of solutions, a distinct set of solutions. You change your model, you have a whole different set of solutions. And so if we were to put medicine, biomedical model, this treat the symptom, put that aside, and instead of being focused on treatment, which we don't have, not specific to dementia, you can't return my rational thinking to me with a medicine or a therapy. Well, you might be able to. That's another discussion. But if you turn and look at the experience, the functions I'm losing, now move from medicine to psychology, begin to apply what we've been coming to understand in neurology. Forget about the world of dementia care and go to the people who have been studying neurology, psychology, and philosophy. Ian McGilchrist, Daniel Kahneman, Ellen Langer, Atul Gawande, of course. But I have learned more from Ian, Daniel, and Ellen Langer than from anybody in the world of dementia care. And it's because we are complex beings, and the way we behave reflects how we feel. And the way we feel reflects what's happening, our experience. And if you can't cure my problem, we should be thinking about how to provide care for me. And care is totally different than Gawande said it the best in Being Mortal. A treatment model is not a care model. And hospice is a care model. But dementia should be responded to, again, with a care model. I spend more time talking now about changing our model, how we define dementia, so that we can have better solutions. And that's asking people to really step back and look at the big picture. I think those the thinkers, the movers and the changers, those who are affecting policy, we should be doing that. We should step back and look at the big picture, question the model. Because we've already proven over and over for decades that it is extremely expensive for both those who care and those who experience dementia, both emotionally and financially.
Absolutely.
It's affecting the whole country and all of our governments. Yeah.
So, Judy, with the increase that we've seen in Alzheimer's and dementia's diagnosis across the United States, are you seeing an increase in people who are coming to you and saying, we need help, we need training, my staff needs to be able to manage this, my family member, our family caregiving village that we created needs to know how to manage this and what to expect and how to deal with it? Are you seeing an increase in people coming to you for the Dawn Method?
There's a profound and marked stony silence from the corporate world. And there is I can barely keep up. We can't keep up with the grassroots, the people, families coming to us, small companies coming to us, small agencies, one-off. Caregivers, people who are concerned, people who have had a loved one, or people who currently are looking after a loved one. A huge response, an enormous demand coming from people, and the corporations not interested. They are not interested in any possible way, even if you demonstrate that it's cheaper. They don't care.
That's interesting.
And sad at the same time.
Yes, because we know that is one of the biggest outflows, or has been in the past, is at least in hospice care, is the care of our dementia patients with dementia.
True.
They are with us longer, and
Yes.
they cost us more. And so digging into my regulatory background, right? Several years ago, the Center for Medicare and Medicaid Services limited how we can use dementia diagnoses.
Yes.
And it wasn't
Yes.
because that it wasn't a need. It was because it had become one of the biggest expenditures.
Exactly.
Yes.
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 I followed that too.
Yeah. It's sad, but that's not an appropriate response. That's an around the end run to try to avoid having to pay for it. It's not upstream.
Cutting off your nose to spite your face.
Exactly. It's not
It's pinching
upstream
pennies.
management. Yes.
Penny
yes.
wise and pound foolish.
Exactly.
Yeah.
Exactly.
Yes.
Yeah, that's true. Well, while we're on this subject, tell us how our listeners can connect with you and your work and find out more about the Dawn Method.
Lately, I think you can just Google the word Judy and dementia, and that's me. Or you can go on YouTube and do the same thing. But branding it and coming up with a name I thought would excuse me and let me go retire quietly in the backwoods of Idaho, but it hasn't happened. The website is thedawnmethod.com. And Dawn is, I very carefully chose Dementia and Alzheimer's Wellbeing Network because I wanted Dawn, because it's good news. There's a way to work with it.
Right.
But thedawnmethod.com, everything is there. And if I'm slow responding to your email, please keep in mind that I get desperate queries every day, people trying to help them that they love, and all around the world. I do a lot of work in Brazil. We just started working in Malaysia, Japan. I've been selling a lot of books in Japan ever since the first year I published, I think. Lots of work in Britain, Canada, Italy, Germany, everywhere, Switzerland, so Poland.
Wow.
Yeah.
That's incredible. Of course, as you have said, it's needed everywhere.
It is. Everywhere we have corporations exporting American processed food, we are exporting dementia. But that's another discussion too.
That is another podcast, but absolutely.
Yeah.
And I will have links in the show notes to your website, to your books, links for the certification courses, and for the family and agency services that you provide. So anybody that might need anything will be able to connect with you. We like to talk about our wishes, the big wishes, and what we hope for. So we would ask you, what would be on your wish list, your wildest dreams for dementia care?
That we could separate the word dementia from the word crazy.
Oh, yes.
That we could take our eyes away from this fear-mongering and us and them response and recognize that every day, every one of us accommodates a companion who has poorer memory skills or better memory skills than we do. And every day we are accommodated by somebody who has better rational thinking skills than us, better intuitive thinking skills, or better attention skills. And we need to just start recognizing, as a people, we need to recognize that we see the world because of the way our brain is designed, basic neurology, that we could recognize our cognitive skills and then just be kinder, cut each other a little slack. And when somebody doesn't have memory skills, let it go. If you've got yours, why do you both need memory skills? Right? There's two people. Why do we both need memory skills? Doesn't that just cause arguments? Let's just accommodate each other. So I would ask, that's my wish, grace. Let's just cut each other a little slack. Be gracious.
Yeah, that's good.
Learn about the other person.
I love that. Judy, this has been so encouraging to me to hear you talk about the Dawn Method, because I think there's a lot of help that people can receive through this. And I hope that our listeners will take advantage of what you have to offer. And thank you for coming up with this method. It's obviously something that's needed now, and it's going to be needed even more in the future.
It is. Spending time with my neighbors there in Moscow, I heard, I listened, I watched, I learned what they were experiencing, what they had to say. So I'm just putting it into words for them. They're the ones who are really courageous and wonderful.
It's perfect. Very needed. Thank you.
Welcome. Thank you for inviting me.
She's
got kind of a remarkable story.
It really is. Wasn't something that she had any intention of starting. It just sort of fell into her lap as she went over to visit with her neighbor.
And she said she would just help her neighbor out.
I was really impressed by her neighbor. I mean, the neighbor knew that she had dementia, that she had Alzheimer's, and yet she would leave herself notes. She would set a timer. She would put things in her calendar, and she would set a timer to say, go check your calendar.
So this lady was a woman who lived alone.
Right.
Right. And we know that solo aging is something that a lot of older people are doing. They're aging into this system. They don't have caregivers. They don't live with anybody, either by choice or just by circumstance. And we're going to have this need. Alzheimer's and dementia on the rise, not enough healthcare providers to manage them, and a lack of intuitive care. So the Dawn method really provides a framework that makes so much sense.
It really is. And we have heard and seen many dementia and Alzheimer's patients who suffered needlessly because their caregivers didn't know how to approach them, didn't know how to deal with them. And this is what Judy has come up with, is a method to help the caregivers know how to work with people who have Alzheimer's and dementia.
She has online courses. She has in-person courses, and she has certifications for people who are working in a facility, for agencies or facility staff. So if you're interested in connecting with Judy Cornish and learning more about the Dawn method to maybe enroll in her courses, you can go to thedawnmethod.com and look under families. There are some great resources there. And then under certification, there's a page for individual caregivers and for facilities. So we would really encourage you, whether you are a personal caregiver, an unpaid caregiver, or a professional caregiver that works with Alzheimer's and dementia patients, check out thedawnmethod.com. She's got some great resources there.
Thanks for listening to The Heart of Hospice. I'm Jerry Finter here with Helen Bauer. Because we know your hospice journey is 24/7, you can always find us at theheartofhospice.com. Subscribe to the podcast wherever you're listening and leave a rating or a review on Apple Podcasts.
To connect with us, just send an email to host@theheartofhospice.com. You can also find us on social media. And remember, no matter who you are or where you are in your hospice journey, you are the heart of hospice.